Hey guys, it's Ryan Osborne here with Oz Coaching, and to continue this, what I'm, calling specialist series, if you will, on kind of enhancing movement quality through, basically kind of the aging process. And with today, I've got Dr. Robert Lake, who's a chiropractor in St. John's. And who also, which I believe also kind of some of the common themes that I have with these other specialists is, really truly values active living, is a runner himself, but really, like I said, understands the continuum of looking at, exercise, nutrition, and kind of just allowing yourself to really be as functional in your day-to-day operations, right?
That's right.
Fair to say,
yes.
right?
Yeah.
So just to kind of, there we go. So I think, really the point that I wanted to bring about from the chiropractic sense is like, tell me, I guess, the common clientele, right? That you do see, kind of the ages and I guess the common themes that you see on a regular basis.
Yeah, I mean, I guess typically, for myself anyways, we're looking at about, mid-30s to kind of mid-50s, male,
Yep.
female is kind of my general patient population.
Yeah.
Most of my patients tend to be fairly healthy, active individuals.
Yeah.
And again, given that age bracket, of course, as you well know, there's, certain things that we have to do as we get older to help try to be as
Clearly.
mobile and as active as we think we still can be while we were 15, 20 years ago, that
Yep.
sort of stuff.
Yeah, absolutely.
Yeah.
There you go.
So outside of any real acute injuries per se,
Yeah.
of course, they're always dealt with a little more specially.
Yeah.
Most of the regular things have to do with mobility issues,
Okay.
just from years of abuse
Mhm.
and or years of working in an office, which will parlay and play a role also in your outside activity levels.
Yeah, absolutely.
So that comes down to mobility issues.
And I mean, with the mobility issues there, like, just, I guess, to just hone on it through, like, I know you primarily, as we spoke kind of just before this, was really that kind of lumbar, spine, hip, is that kind of really key area, right? So you're saying
low back and pelvis.
Exactly. Okay, perfect. All
low
right.
back and pelvis is kind of my area of particular, I guess, interest. And it's someone comes in, it's really like trying to solve a puzzle, play investigator. I mean,
Yeah.
most people will think that it's commonly it's one thing is my issue.
Yeah.
Unless there's really been like an acute trauma to one particular area, all of this kind of cumulative kind of stuff tends to be 5, 6, 8, 9, 10 things kind of going together to give more of a functional problem.
Yeah.
So trying to tease out the various parts of that
Yeah.
is kind of part of the fun part of the game on a regular basis.
Yeah. So when
Yeah.
you say, like, again, trying to address mobility-based issues, right? Muscle imbalances. But I guess, yeah, just obviously to elaborate on that is, like the value of, because some people just think, again, where there's fire, that's the smoke, or sorry, where there's smoke, that's
Right.
directly where the fire.
Right.
And I know you just talked about kind of the puzzle, but yeah, when you say, work on mobility, so yeah, so obviously that's the hips, right? All quadrants of the hips, like any particular areas that people need to kind of, I guess, focus on more.
Well, as far as,
from the lumbar, pelvic.
If you're looking at mobility itself, it tends to be a combination of mobility and then other areas being overactive or underactive.
Underactive.
All right, so muscles can be short, muscles tight, muscles weak, all sorts of scenarios.
Yeah.
Things can be, I guess, painful.
Yes.
For all kinds of reasons.
Yeah.
Things can be short for all kinds of reasons,
Yeah.
either overactive or underworked also for that reason. Right?
Absolutely.
Yeah, so as far as the low back and pelvis kind of goes,
Yeah.
one of the more common kind of patterns, I guess, that we'll see in clinic on a regular basis, and this is true whether you're a runner, you're a triathlete, or you're an office worker, and kind of a weekend warrior kind of thing, is you'll often see kind of lumbopelvic muscle imbalances.
Yeah.
So people
Absolutely.
often tend to have overactive hamstrings. Psoas muscles, your short hip flexors
There we go.
are often commonly short.
Yep.
Then you have a dual inhibition then of your glutes, which are your prime hip extensors.
Yep.
So then you get more stress placed into the low back, and then it's just one cascade after another.
Okay.
So typically, dealing with that, once we kind of get figured out which muscle groups are involved in which way, we'll give corrective exercises to lengthen, tighten, stretch, whatever.
Exactly,
Yeah.
your place in
Yes.
order to work
Yeah.
to kind of,
Yeah.
and then from from the stability, like mobility is great, but then
Yeah.
like you said, the value of the core, not just for that one specific core region,
Yep.
right? If just
Yeah,
to
so-
talk on that, right?
Yeah, so core wise, if anyone is looking to stabilize their low back,
Yeah.
certainly it's a 360 approach. So
Yeah.
we're looking at the anterior, the posterior, and lateral compartments.
Absolutely. Yeah.
We're also looking at the thoracic spine
There you go.
because the muscles in through the T-spine, when
Yeah.
they come down with their tendons and they connect down and through the low back
Yeah.
and
Spinal direct.
right down low,
Yeah.
they have mechanical advantage to provide actually a fair bit
Bit
of core stability for the low back itself.
Great points. Great points. Good. Good. No, I mean, I think that's like you said. It's all part of the continuum. But some people, no question, that just immediately say, my back. I've got, and again, not in the context of an injury, worker's injury, or say an accident specifically. But a lot of people, I hear, certainly on a fairly regular basis. But you would obviously see it more as just, I've got my back this, so just give me back exercises or give me a back stretch.
Sometimes there's a little bit of treatment needed up front to kind of just get literally a few of the stiff joints in through your pelvis or low back loosened up.
Yep.
And then that can often be maintained with a little bit of advice of how to work on things at home with either a lacrosse ball, a foam roller, any number of devices.
Yep. Yep.
And then from my perspective, I would often, see someone in clinic in our gym a couple of times, make sure their technique is solid, kind of get them going at a level that's appropriate for their abilities.
Yeah.
And then when they've mastered that, we'll send them off with a progressive program to work on themselves.
Perfect. No, that's in my view, a couple of great points. Like I said, understanding. I think in some cases too, giving you a little bit of I guess of a window of people understanding exactly what chiros do as a whole as well.
Yeah.
Because some people just view a chiro adjustment right off the hop, right?
Very true, and I mean certainly is I guess the hallmark of kind of what we do.
Yes.
But I can tell you now, I mean I've been in practice for almost 18 years.
Yes.
And there's been patients I haven't felt the need to adjust once because it's not where their issue is coming from. Things could be sore in the spine, but it might be because things are hypermobile. The goal there, of course, is to stabilize.
Absolutely.
Things might feel good following an adjustment if things are loose, for example. But if you do that too much, you'll make the problem worse.
Absolutely. More instability.
Right.
Okay.
Right.
Hope you've got a couple of great points from that, and like I said, appreciate Norbert obviously for doing this.
Thanks, Ryan.
All right,
Appreciate it.
and we'll talk next time, guys.